Good morning. My name's Melissa Stone. I'm a Vice President and Principal Engineer at the WGM Group, and I also have the pleasure of serving as this year for your United Way of Missoula County. I want to welcome you all to our 2020 annual meeting, and thank you so much for joining us virtually today. We're so excited for the United Way to be embracing this opportunity. This year, we have a new video about our United Way, thanks to Windfall Studios for producing this, and to Payne West for being our video sponsor. After the video, our CEO, Susan Hay-Patrick, will get us started. Thanks again.
Problems, the ones that erode our community, the ones that divide us at coffee shops and dinner parties, the hidden ones no one has solved. We go looking for them in unforgiving parts of town and seemingly docile neighborhoods. We find every dollar we can to address them. But we are more than fundraisers. We are hand raisers. We are stop talking, start doing, take on the impossible game changers. We lead the way. United, we confront homelessness in Missoula. United, we stand up for children and families who need our help. United, we reach out to those at risk of suicide. No matter the obstacles, no matter the odds, we surround our community's most critical problems. And we fight. We fight for those who need a voice and those whose names we do not know. United Way of Missoula County fights for the education, financial stability, and health of every person in our community. Because change doesn't happen alone. Hope isn't a one-man band. We are all connected. We have one life, and we must live united. Together, there is a way.
Wow, whose voice was that? That person has like a career in Hollywood. I'm just sure of it. Everybody, thank you all for being here. I'm Susan Hay-Patrick, CEO of United Way of Missoula County. Thanks for your patience with our technology. One of our speakers is still trying to get on the call, so we're not the only ones having issues. And by the way, I wanted to have a United Way banner behind me instead of the dour ancestral portraits in my living room, but I couldn't quite handle the technology. But anyway, we'll figure this out. We've all gotten more adept at Zoom in the last several weeks. You know, in times of great uncertainty, we look for things we can count on with certainty. For me, it's the sure and certain knowledge that at least one of my cats will crash every Zoom meeting, so I apologize in advance for that. And to those of you who say, why don't you just lock them in the room? You're funny. And to you homeschooling parents, my hat is off to you because I can't even keep 2 geriatric cats under control. I'm going to start, even though I don't think that Dean French is yet with us. He says he's going to call in, his computer's dead, I'm getting all kinds of frantic texts, but Joyce, you might have to carry the show on your own. But
I'll do my best.
Okay, wonderful. And you know, I joked about in times of great uncertainty,
oh,
but
he's on.
Okay,
he's
perfect.
On.
Perfect. Great timing. In times of great uncertainty, we look for leaders, for capable leaders. And during a pandemic, we especially look for them in healthcare.
Thanks, Susan.
Missoula, are you there? Can you hear me?
Oh God, yes.
Well, be quiet. I'm introducing you. During a pandemic, we look for those leaders in healthcare, and Missoula is lucky to have two such leaders guiding our two local hospitals. Joyce Dombrouski, Chief Executive of Providence's Montana service area, which of course includes St. Patrick Hospital, and Dean French, CEO of Community Medical Center. Both Joyce and Dean have long and strong backgrounds in healthcare, not just in hospital administration, but on the front lines. Joyce as a nurse and Dean as a physician. Most importantly, Joyce and Dean are both longtime United Way supporters and foster a culture of caring at their respective organizations, where giving back, including to United Way, is encouraged. So thank you both for joining us today and for all you're doing to guide Missoula through this pandemic. So I guess an obvious question is, I'll start with you, Joyce. What were the biggest challenges, or what are the biggest challenges you're facing in terms of COVID-19? And what are you most proud of in terms of your hospital's response to the pandemic?
Thanks, Susan. First of all, thank you for the opportunity to talk to so many of you this morning, and thanks to Dean, who's entitled Jim Gillhouse, actually. So I'm glad he was able to get on. I would say, as really focusing on St. Pat's first, the biggest challenge was to create the incident command system and get ourselves ready for what we were anticipating to be a surge of COVID patients. And it sounded like that was going to be daunting, but as usual in healthcare, there's so many of us who respond to sort of that hero mentality and getting together and creating the plans and meeting every day and including on the weekends and making decisions and communicating. And so it was, although it was daunting, it was sort of in an odd way exciting, because we felt a responsibility and a call to be prepared, and that our community needed that of us and that we were clearly capable. So I'm most proud of that. I would say we had absolute participation from every single entity in the organization, every single level. We talked about clinical care, we talked about supplies, we talked about impact on the community, we talked about testing, everything. I think the biggest challenge today, May 28th, is that because we were so prepared and really didn't see the surge, now we're how do we stay prepared, stay with that level of excitement around that we need to serve our community, and also ramp back up to the more traditional care that the community desires of us, and not get fatigued. I think there is a little bit of honestly leadership fatigue and caregiver fatigue that we're experiencing. It's not bad, and I would tell this community that's our job as leaders, is to lead through that and help really our caregivers and our leaders to stay strong. So it really is in the ramping back up phase of, we have to go back to doing what we always have done best phase that we're in. So I'll turn it to Dean.
Thanks. Dean, I just told you to mute yourself, but now I'm going to tell you to unmute yourself.
I generally take direction from you well, Susan, so generally. I will actually not add much new. Joyce's commentary is spot on. I'm most proud of our facility pulling together, and just how remarkable our workforce was, and giving the leadership here grace to sort through this. We were all learning as we went. We asked them to do things very differently, very, very quickly. Like Joyce, standing up our incident command structure, lots of hours in the first few weeks. I think our leadership team worked about 17, 18 days straight without a break when this first started. And, we asked our employees to cross-train into roles they had never done before in anticipation of a surge. In about 3.5 weeks, we had trained a whole new cadre of physicians and nurses to be ICU prepared in case we had a surge. We went from 4 negative pressure rooms in the facility to 24 negative pressure rooms in a period of about 2 weeks, and our facilities engineers just bent over backwards trying to figure out how to convert our building and make it a safer, better environment that could handle a potential surge. And so watching all that activity and watching how quickly we adapted was probably my greatest moment of pride. And secondly was just our own team here, from the the environmental services worker all the way to the physicians, pulling together and really stepping up with great questions, but also always asking what they could do to make this thing work. They always say that in times of crisis, there are people that run to the fire and those that run away. And I watched our facility and our team walking straight, no hesitation. We're going to get this thing done. We didn't have a lot of people heading for the exit saying we want to work from home or we don't want to have to, they understood their role, and it made it much, much easier to lead through this.
Thank you. Thank you both. We have heard a lot about collaboration as a characteristic of Missoula's response to COVID-19. So can you, I guess, Joyce, going to you again first, to give us some examples of how your facilities, your two hospitals collaborated?
Right. I think I would say that Dean and I, in sort of a natural way, collaborate on as many things as we can. And so when this started coming up, we actually ended up talking to the mayor really early on about what would our role be with the city county health department and how could we be leaders and at the same time have the respect and acknowledgement that we do have a county health department that really has legal authority for this pandemic and the management of this pandemic, and how could we work together. So that wasn't hard. I think the working together continues, and it continues to sort of be in what ways. There was a testing site meeting, and we had extra masks that we could contribute, and I think, Dean, you had extra swabs. I mean, we were really down at that level of collaboration. I think, so that's not, you're right, it's not new in this community, it's not new for healthcare, and it wasn't just between community and St. Pat's, it is again with the county health department. We worked with Partnership Health Center. They ended up doing some of the screening with the Poverello, which really made more sense than, let's say, the hospital doing it. Dean and I both had clinics that we were already opening to screen the community, and it was, for me, it was really a matter of, are we doing it in the same fashion so that no matter where you accessed in Missoula County, you were receiving the same standard of care. And again, that's directed by the health department. So I think it was sort of easy to collaborate, but I know I would say for myself, it was that balance between staying focused internally, making sure that our incident command structure was doing what it needed to do from the hospital side, and then keeping an eye towards the community and making sure that we were playing the right role in the community.
Thanks. Dean, same question, collaborate, other examples.
I would just, again, echo Joyce. I think a couple of things happened early on. Both Joyce and I felt it was important that the two facilities, in essence, made policies and procedures to address this in our facilities that were essentially in lockstep. There was very little difference in terms of how we managed visitors, how managed whether the decision on universal masking, or there was a constant dialogue going on between the leadership teams of both facilities, and more often than not between Joyce and I. We share medical staff between the facilities, and we felt it was important that the public saw that the two hospitals were addressing COVID in the same way, and that was an important thing for our community to see early on. And we had very intentional conversations about that at the very start of this. In addition to that, to Joyce's point, recognizing what the role of the city public health department is in this and what our role should be in support of their initiatives. We had great conversations with the mayor, with Josh Slotnick, and with the county EOC team, and really good communication. Lots of conversations around testing and how do we roll out testing, and make sure that the public had access. And I think, that work continues, frankly. But, Joyce and I have always maintained a pretty quiet but strong communication pathway to make sure our facilities are engaging in collaborative. I call it competitive collaboration. I don't know what she calls it. But we have the privilege of a relationship that allows us to have free exchange and make sure that we're doing what's best for our community, even though at times we're competing with each other in the marketplace. And it was an easy transition for us, I think. I suspect Joyce feels the same.
Yeah, she's nodding. And I think our community likes to hear that about the competitive collaboration. And I also think that both of you played a role. I don't know if you would acknowledge it, but I feel like you have the governor's ear too, and that one of the reasons Montana has done so comparatively well in this situation is because the governor had advice from people he trusts and respects in the field, and I know that both of you are in that group. So,
and I want to public acknowledge something that most people don't know, but Joyce led the charge in the state on shutting down elective surgeries, and she really was out in front on that, and frankly, to the place where we got every large hospital in the state to agree to that before the governor ordered us to do it. And in fact, he never did order us to do it because we got it done. And I would say that was in no small part because of Joyce's efforts. She was a fierce advocate for all of us getting on board and getting that done.
That's great. Thanks,
Dean. I'll say thank you, but it was certainly, I would say one of the things to make all of us proud in Montana is all the large hospitals quickly understood the need to do that and quickly understood the opportunity to not to allow us to do it ourselves rather than wait for the governor. And then we subsequently have felt I would say the positive side. We weren't waiting for the governor to then undo a declaration because we didn't put him in a position to have to make one to make us consistent. So I mean, you use that word team effort or group effort, but this was clearly that across the state.
When the three of us were talking recently, you mentioned that we're not out of the woods yet. So starting with you, Dean, what's your best advice for Missoulians as we enter the phased recovery and head into summer?
It's a great question, and I'm going to echo a little bit of what Joyce talked about earlier. I mean, as we've been holding town halls here with our employees around this subject because as we ramp up and try to offer the services that Missoula expects us to offer, we want to do that in the safest way possible. And, the great fear that we have, and I suspect it's true across town too, is we don't want to ever compromise our facility's integrity at its ability to take care of folks because we did not manage the public health threat well at our front door. And so for us, it's about establishing new normative behaviors in our operations across the board to make sure that everything we're doing ensures that down the road we're able to continue to provide the services and we're not having to roll back again or turn off services because of conditions changing in the community. But with the reopening, and we have a dichotomous message. So there's a reopening out there that says, hey, you don't have to 14-day quarantine anymore. You can gather 50 people together and, you can go to the bowling alley, right? That. I'm not sure why bowling alleys got the green light compared to some other things, but they did. I didn't use a rental bowling ball personally. Anyway.
Thanks for clarifying.
Yeah, but that's for us that are in the healthcare business. I look at my workforce and I say, guys, we have to lead by example. We're telling our employees not to travel out of state. We're asking them not to travel out of state. We're asking them not to attend gatherings of 50 people. We're asking them to essentially still try to maintain a shelter-in-place attitude in terms of the facility, universal masking. But we're also asking our employees to mask when they're out in the public, largely as a show of leadership. If I'm a physician and I'm at Albertsons without my mask on, what message am I sending? We don't believe that COVID is done. And yes, Montana enjoys the lowest incidence of COVID in the country right now per capita. But it doesn't take a lot. And the recent little spike that we had in Ravalli County that effectively took 14 healthcare workers out of their jobs for 2 weeks is exactly what we don't want to see happen in Missoula and to either one of our facilities, because then all of a sudden, if there is a surge or a catastrophe of any kind, we're not necessarily as capable as we would have been to take care of our public. So we're approaching this as, this is great, it feels like things are getting better, but we need to maintain a lot of diligence and a lot of vigilance in our processes. We're still limiting visitors. We're still making everyone wear a mask if they come to our facility. And we're still testing all of our elective surgeries for COVID prior to surgery. And that we anticipate will continue I've told my staff, until the end of the year at a minimum. So to us, it's a new way of doing business. I don't know if I'm answering your question, but.
Yeah, no, that's great. I love the example of showing leadership by, wearing a mask and not traveling. And I think that's a really valid, great point. Joyce, same question, like advice as we enter this.
Right. Thanks. Yeah, I would echo again, many of the things that Dean talked about is exactly what we're doing here. So that's in that spirit of creating that standard. I think it's really to appeal to our public to not fatigue, I keep using the word persevere. It is hard. There is not one thing that's been easy about this, but that's put us in the position that we are in this state. And so don't not wear your mask, don't not social distance, think twice about, do I need to go to, even if the store is open, think about, do I need to go? Now the flip side, and again, Dean and I are on the Missoula Economic Development Board too, is, how do we not discourage businesses from opening up safely for the economy side? I mean, it is a little bit of a challenge, and the same thing for healthcare. We want to provide safe care. We want patients to come back to our physician clinics and our hospitals. So that it's that message of, I would say, deliberate, thoughtful approach, complete change. I mean, I sort of think about wearing masks almost forever. I mean, I think about how do we help people understand that, until we're out of the woods, whatever that means, this new way of doing business or being in the world is really the way. So it is following all of those guidelines, even if you think you shouldn't have to, or even if you think the data doesn't support that. I think it's the converse. The data supports that doing that makes perfect sense. And if you can get it in your head, that's the way to be out in the world, rather than I'm just going to do it until the end of the month. I think it's really taken the long term, but I do know it's difficult. I mean, at a personal level, I don't really like wearing a mask. I mean, I really don't. And I don't, I'd sort of like to be able to, sort of give someone a hug, and that,
right.
But just, you just have to really stop yourself and say, I can still show my respect and show my admiration by, talking and not touching. So it's a difficult one. The other thing I want to mention to this group of people that, again, Dean and I have been involved with the governor's office. He does have a desire to test asymptomatic Montanans to the tune of 60,000 a month. And that work will be organized by each county health department. So you're going to hear about that, and it makes sense to get an epidemiological picture of that. And so what we're doing again is trying to figure out how do we work with our county health department to support that particular effort. So that'll be, I think you'll hear more about that in the community, and there will be tiers of individuals, obviously, who will get tested first, but it really is the move to the asymptomatic look of this disease.
Thanks. Just a couple minutes left, but I've heard a number of your fellow healthcare CEOs around the country saying there's no going back to normal, that in the words of one of them, it's time for better than normal in terms of healthcare. I'll start with you again, Dean. Can you think of innovations or new ways of serving your patients and the community that have come out of this or have been amplified as a result of this experience, and which you could capitalize on going forward?
The list is long. The recent one I can tell you about is an access issue that, actually oddly COVID solved for us And I was speaking with one of my pediatric speech language therapists yesterday, and they converted on a dime to doing all these visits with pediatric patients via telemedicine. And the reality is, what they're learning is, it's effective, but for a working mom or a single parent who's trying to bring their child in on a regular basis for speech language therapy appointments, there's big barriers there for folks. And interestingly, telemedicine allows them a much greater opportunity to actually access those services in a way that works within their lives. And we're realizing that we need to really rethink how we do the business of medicine. And, telemedicine is the most glaring example of, one of the conversations is, gosh, we want to be able to continue to do this, and we should do this. It's the right thing to do for this group of patients. Will the government allow us to? Because what people don't know is that early on in this, what happened is all these restrictions on telemedicine in terms of how we get paid got lifted, both by the commercial carriers and by Medicare and Medicaid. And so the big question is, how is the government going to respond on a go-forward basis? Because we're seeing that we can provide better care, improve access, but what happens if they say, well, we're going back to the old rules, and you can't get paid for that? The only way we could get paid for telemedicine before was the patient had to be in a licensed healthcare facility with that telemedicine connection in order for us to bill. They cannot be at home, which, those are the government rules. So those rules are the ones that got suspended in the face of COVID. It would be lovely to think through this with Centers for Medicare and Medicaid Services about what should we be doing, because clearly there are ways that we can take away barriers to access to care if we're more thoughtful, and COVID has demonstrated that. So I would say that's one of the bigger examples, and there's a multitude. The other thing that we've talked about is, we talk about influenza. There's been a lot of controversy about, is COVID, as bad as the flu? Well, here's what I know is, how many flu deaths could be prevented if the healthcare system treated the flu like we treated COVID? And shouldn't we be?
Interesting. Thanks. Joyce, same question.
Yes, I'd say, the telemedicine, to be able to ramp up sort of from 0 to 100 so quickly was, we didn't really realize we could do it. And really the value is continuing to be exactly what Dean said. The other sort of thinking through is, how do we remotely take care of patients? There's remote patient monitoring opportunities for chronic care patients to stay in their homes. And we've read about them checking their blood pressure or checking their weight, for example, some very rudimentary but pretty important clinical measures. And so how do we ramp that up to make sure that a person's primary care physician sees and is overseeing that level of care without bringing the chronic care patient, again, into the facility? We've been so sort of facility or office driven, like, you come to us, and now it's like, wait a second, we can come to you differently, and how does that look? And I don't think that means a lower standard. I think it means a different approach and an opportunity to be creative. So that's really what we're hearing is, how do we not try to go back to how we used to be? In fact, resist that at every turn and stay forward focused and innovative and creative. And we have a lot of really smart people in the world, including in healthcare, who I think will propel us forward as long as we don't sort of hold back. And a piece of holding back, unfortunately, as Dean said, is payment. But I think we've learned a lot, and I think we need to use that momentum to sort of, again, to propel us to a new way.
Thank you so much. This has been really interesting, and I am very grateful to both of you for your leadership. Some of you have heard me say that I feel like my leadership secret is my ability to hide my panic from others. I feel like very confident in the top leaders of our hospitals, and I think it's just a great thing for our community. And of course, also thank you so much for your longtime generous support of United Way and encouraging that in your institutions, and we really appreciate that.
Well, thanks for the opportunity.
With that, I'm going to turn it back to Melissa for, I believe that's my next job, right? Board elections.
It is. Can you hear me a little bit better from this location?
Yes.
Great. I'd like to echo first your thanks to Joyce and Dean for joining us this morning and your support of the United Way. And also, since I think I was not real intelligible before, I'll step back before stepping forward. I'd like to make sure to give credit to Windfall Studios for their work producing earlier, and thanks to Payne West for being our video sponsor. Thank you all for attending today. Again, my name is Melissa Matassa-Stone, present. Now, as we look into moving into board elections, our board members are elected during the United Way's annual meeting, and all members are invited to participate in the vote. Members are defined as those who have donated any amount during the past year. We were hoping we're going to use Zoom to vote, so bear with us here, and I'll kind of give some direction after introducing the slate. So our slate today includes one new board member, Rebecca Dubois, and we should see on the screen here in just a moment a little bit about her. There we are. It's coming. Executive for Insurance, and thanks again one more time for sponsoring our videos here. Before moving over to her insurance career with the Farm in 2015, and currently serving on the United Way's Development Committee and is the ambassador for PNS. I really enjoyed over through her service on the Development Committee, and I'm excited that she's agreed to join our board. So now, for our elections. From our executive committee, we have a motion to elect the following 3-year terms on the United Way's board of directors. It runs from 2020 to 2023. First, we have Rebecca Dubois with West Insurance. This would be her first term. Next up is Glenn Landquist with Clearwater Credit Union. This would be her first term. She previously been serving a vacancy on board. Randy Riley with Wells Fargo, also his first full term, and also previously filling a vacancy. And finally, Holly Truitt with Holly Truitt Consulting, and this is her second term. You'll see the chats are on the right. To not assume how familiar with Zoom, if you go to your bottom bar, you can see where you can put your mute on and off video, and there's a little button that's chat. If you click on that, you'll see somewhere you can type a message. And I would please type in yay to vote for this slate of officers. If you do not approve this motion, please type nay and hit enter. And you can also opt to refrain from voting by typing abstain and hitting enter there. And we'll give a few moments here for folks to vote. As I scroll through the group chat, looks like the yays have it and the vote passes. Thank you and congratulations to Rebecca, Gwen, Riley, and Holly. Randy Riley, and Holly. Let me turn it back over to Susan to talk about some of the great work we've been up to in this past year.
Thanks, Melissa. And by the way, the cat crashing of the Zoom call is beginning, so expect to see a tail across the screen momentarily. Thank you, Melissa, especially for agreeing to serve an additional term. Right after this meeting, United Way board members, please stay on to elect the slate of officers that we've put forward, which will be Melissa as chair, Mike Nugent as vice chair, Randy Riley as secretary treasurer, and they, along with our immediate past president, Dwight Schulte, and I will be the executive committee for the year ahead. But thank you all for voting, and thank you all for your service. So I think you all know at United Way, and I think the video says it, we envision a community where everyone has an opportunity to succeed and our entire community thrives as a result. We were getting a little closer to that vision every day with help from all of you and a few thousand others, and then the pandemic struck. and we pivoted. My colleague Bob Homer said the other day that something we're good at United Way is being nimble, making decisions quickly and executing on them. And I think he's right. We immediately transitioned our Emergency and Disaster Assistance Fund, which usually is used to help with fires and floods, into a COVID-19 fund, which I think many of you contributed to. We have so many contributions from so many individuals. We're not able to list everybody. Here on the slide, we've listed our institutional gifts of $5,000 and up. We've raised about $550,000 so far. We've distributed most of that. I think many of you know that the fund principally was used to support service and gig economy workers, very tip-dependent workers, the people who care for our kids and cut our hair and serve our drinks and serve our meals and work us out at the gym. Most of them have very few resources to fall back on. And we've made hundreds of grants of up to $400 each to those people. And honestly, if you read the applications, some of the stories would break your heart. So we were very happy with so much help to be able to distribute those grants, and also to make grants to several of our longstanding United Way partners who help those most vulnerable and who have been affected by the pandemic. So that also now, as we look forward, we're going to pivot and start thinking about longer term needs in our community. We don't know what those are, but we want to be able to respond. And again, to pivot and be nimble as necessary. We have a very strong COVID Fund Oversight Committee that's helping with this. And of course, our board and staff will be weighing in on those decisions down the road. We also responded in other ways. Many of you may know that we are the sort of official drop-off location for homemade masks. We are so grateful to people who have made masks. Please, if you're one of those people, keep making masks, because as we've just heard, the need is not going away, and we cannot keep up with the demand. We have them laundered thanks to Missoula Textiles, and then we distribute them to organizations, frontline organizations, healthcare organizations. Thanks to Wells Fargo, first back to thanks to St. Pat's and Headwaters Foundation. We have a funding for emergency childcare, including to reimburse childcare providers for emergency cleaning supplies, gloves, sanitizing supplies that they've had to buy in order to stay open or reopen. Thanks to Wells Fargo, a flexible housing assistance fund to provide emergency rental assistance to people who are homeless or fleeing domestic violence. Our staff leads or serves on, you name it. If there's a task force in this county or in Montana, we are represented on it. Our Missoula Nonprofit Center and volunteermissoula.org are sort of a central address to share information. We've even hosted CEO happy hours for nonprofit CEOs during the pandemic to share information and just get moral support from each other. And Volunteer Missoula links organizations in need of volunteers with people who are able to volunteer. A good example of that is Missoula Aging Services. Many Meals on Wheels drivers are those most at risk for the coronavirus, and so they were left shorthanded without drivers, and many people through Volunteer Missoula stepped up and helped. I don't know if you can hear the cat meowing, but it's beginning. And then I think some of you are aware of the Justin Angle podcast called A New Angle, and I was really privileged for several weeks to be part of an 8-week COVID collaboration with Bryce Ward from the Bureau of Business and Economic Research and Grant Keir from Missoula Economic Partnership, just trading stories and keeping our community informed of Missoula's response to COVID-19. So we really were, that pivot really was effective as we responded. You know, this is the annual meeting where we usually give awards and some of our most important awards, but we'd rather do that when we are able to gather in person. But I do want to recognize my colleagues for their outstanding and extraordinary work on behalf of United Way. I don't want my picture in there, so let's just ignore that picture, because it's really about them. They haven't missed a beat, whether it was shepherding our PPP application through the banking maze, entering, acknowledging, and tracking hundreds of donations to our COVID-19 fund, completing the video you just saw this morning, making sure that our work on suicide prevention, early childhood, strengthening the nonprofit sector didn't lose ground, keeping the wheels on the bus by making sure the bills were paid, or chairing and serving on those myriad task force. Your United Way staff has gone above and beyond during this unprecedented and challenging time, and they are all amazing. I think my colleagues would understand if I singled out Eric Legvold, our Director of Impact, for his incredible work 7 days a week on our COVID-19 response, including playing a key role in designing the fund criteria, reviewing hundreds of applications for assistance, recruiting a cadre of volunteers to do the same, making decisions and making the tough calls to people who weren't approved for help from our COVID-19 fund, collecting hundreds of masks, getting them laundered and distributed, and still doing his day job. So Missoula owes all of my colleagues a debt of gratitude, including Eric, and so does United Way. A few other folks to single out today. I'm so glad they're on the call. Lena Negretti and Jim Morton from 211. We could not have administered our COVID-19 fund without their tireless work, smart heads, and big hearts. And a shout out also to Chuck Irestone, their IT consultant, for all his work on the back end of the fund. You have this idea, we can start a fund. But it's a lot more complicated than that to do it right, to ensure accountability, but still a low barrier application. Also the volunteers who work from home processing hundreds of applications. Our COVID-19 oversight committee that I mentioned, the homemade mask makers, John Becker and his crew at Missoula Textiles, and of course, all those people who donated to our fund. Thank you, thank you. So if you haven't already seen our annual report, it should be in your mailboxes this week. And I think you're familiar with the scope of work that the many programs. Rosie, you can cue that slide. There we are. Our annual report, which I'm very proud of and grateful to my team for putting together. Our Dolly Parton Imagination Library, sending over 3,000 books a month to kids 0 to 5 in our community, helping them start on that path to lifelong learning. 0 to 5, improving outcomes and conditions for all kids in our county and their families in that key age group where most brain development occurs. 5210, Let's Move Missoula, encouraging kids and families to be on a healthier path in terms of activity and exercise and eating well. Project Tomorrow Montana, certainly mental health issues have been brought to the forefront during the COVID-19 pandemic. So delighted to have our new Project Tomorrow coordinator, Rosie Ayers, join our staff. I mentioned our Missoula Nonprofit Center, which is really strengthening and there as a source of support for our amazing nonprofit community in Missoula. Another issue brought to the forefront, of course, always on our minds in Missoula, homelessness and the incredible work that Reaching Home is doing to reduce homelessness among our very diverse homeless population. And as I mentioned earlier, our Disaster and Emergency Assistance Fund has traditionally been used for fires and floods. We're getting back to our home ignition zone project, creating a defensible perimeter and helping homeowners in the wildland-urban interface. It's a very creative thing for a United Way to be doing. We're very proud of it. We have some generous funding for it, and we are going to continue that as fire season approaches. We welcome questions. Please, when you look at the annual report, feel free to call us up, feel free to volunteer, ask us about anything. We love this work and we think we're good at it. And we thank you all for supporting us, because, you know, our relevance doesn't come from operating a relief fund. What makes United Way relevant is the work we do to change our community, to improve outcomes for kids 0 to 5 and start them on that path to lifelong learning and success, to reduce suicide, to get kids and families on a healthier path, starting by preventing childhood obesity, to end homelessness, to strengthen local nonprofits, and yes, to help our community in times of disaster. Our relevance comes from the work we were doing before COVID-19 and the work we'll be doing after COVID-19. And because United Way was relevant before COVID-19, we will, with your support, your time, your money, your muscle, be relevant after COVID-19. We are not out of the woods yet. We heard that loud and clear this morning. We know we are building a bridge of uncertain length to an unknown future. But with your help, we are not going to stray from the vision I described earlier, a community where everyone has the opportunity to succeed and our entire community thrives as a result. So with that, thank you, Melissa. Thank you to our board, our staff, and most importantly, to all of you. And I will turn it back to Melissa.
Thanks everyone for joining us today. Hope you all have a nice rest of your day. Please stay safe and healthy, and we'll look forward to seeing you in person when we can.